Okay, so the question is describe the steps for the examination of fifth cranial nerve. List four causes of fifth cranial nerve palsy. So the step for the examination of fifth cranial nerve and if list of causes for fifth cranial nerve paralysis. Now look at the examination that how can we examine the fifth cranial nerve, and I will also upload a full video on examination of fifth cranial nerve. There are a lot of steps and I will perform the examination of the patient, but here theoretical, let us look at that what steps are required for fifth cranial nerve examination. So fifth cranial nerve has two parts, one is sensory part and another is motor part. In sensory part we have to check touch, pain, temperature, sensation for the face, because fifth cranial nerve innervates the face and anterior part of head, inside of the mouth, corneal. We have to check for cornea, conjunctival reflex as well. We have to check for jaw jerk. There are particular methods and steps for the performing examination of fifth cranial nerve. So uh, uh, by doing these methods we can perform this. We have to check for the touch, pain, temperature, sensation of the face, anterior part of head, inside of mouth, because it innervates these parts: face, head, mouth, cornea, and we have to check jaw jerk as well. Okay, so in motor part of examination of fifth cranial nerve, we will ask the patient to clench the teeth and feel with a hand in order to look at the fifth cranial nerve examination. Ask the patient to open jaw against the resistance and test the pterygoid for both side. We have to test pterygoid muscle for the both side by asking the patient to open the jaw against the resistance, and we have to ask the patient to move the jaw laterally against resistance, and it is a function of opposite pterygoid, means both side. On opposite side we will ask the patient to open the jaw and move it laterally. And then there are and another question was four causes of fifth cranial nerve palsy. So the four causes are multiple sclerosis. In multiple sclerosis cranial nerve palsy occurs. Herpes zoster or trigeminal neuralgia, there is fifth cranial nerve palsy occurs, and cerebellopontine angle tumor. The last one is bulbar palsy. So these are the four causes: multiple sclerosis, herpes zoster or trigeminal neuralgia, cerebellopontine angle tumor, and bulbar palsy. In these conditions fifth cranial nerve palsy occurs, and the above mentioned examination points will be missed in this, will be found or will be pointed out in the examination of the fifth cranial nerve. Means patient will complain of loss of pain sensation, loss of temperature sensation on the face, on the head, on inside of the mouth, loss of taste sensation. There will be absent corneal reflex. There will be patient will be unable to open the jaw against resistance because pterygoid muscle is innervated by this nerve, and that will be defected. So and the causes of the fifth cranial nerve palsy was multiple sclerosis, herpes zoster or trigeminal neuralgia, bulbar palsy, and cerebellopontine angle tumor. So that was fifth cranial nerve.